I am Dr. Mike Milligan. I'm here with Joy Moeller, certified orofacial myologist from Pacific Palisades, California. Joy, thanks so much for being with us.
Oh, thanks for putting this up on the web. It's exciting.
This is a real treat for you. It's such an important thing that we're talking about here, kind of new to dentistry, but I think it's going to be huge in dentistry. So tell us a little bit about this.
Well, what it is, it's a type of therapy dealing with the facial muscles, swallowing, chewing, and breathing. And we deal with people that have noxious habits such as thumb sucking, nail biting, hair chewing, any kind of habit like that.
Yeah. Lip
biting or cheek biting. Mostly with the tongue rest position. We've repositioned the tongue to go up and back instead of down and forward.
Okay.
We help the patient to get control of the movement of the tongue, placement of the tongue. We develop a lip seal where we get the lips together at rest.
Right.
And we work in conjunction with sleep medicine or dentistry, speech pathology, people with temporomandibular joint dysfunction. When it's a muscular problem, we can make a huge difference. We try to develop a symmetry with patients.
Even orthodontics, if you don't get the muscles doing the right things first, you could have relapse, or certainly more difficult to do the orthodontics.
Right.
And oftentimes I think when you get the muscles right and the tongue right, the teeth start to self-correct even.
I'd say probably more than half my referrals come from orthodontists.
Yeah.
Once they get used to working with an oral myologist, they don't want to practice any other way.
Right.
Because it really helps them to eliminate the negative patterning of muscles that is one of the causes of orthodontic problems to begin with.
Right.
If your tongue is resting down and forward all day and you try to put wires on and try to get the teeth lined up, the bite is just going to open. And some orthodontists have put a lot of really neat little appliances in there, and I actually refer a lot of patients for these appliances to help them. But sometimes if you don't look at the way the muscle patterning is interacting with what the bones and the teeth are doing, then what'll happen is maybe then you'll develop a lateral tongue thrust or a unilateral, it could be bilateral, because if they're trying to hold the tongue back with an appliance, then the sides will come out.
Okay.
So what we do is deal with the cause of the problem.
The root problem.
The root problem.
Now, Joy, how did you get involved with this?
Well, actually, the story is that my whole family was affected, actually. My husband had been in a water ski accident and actually broke his 2 front teeth, and he had terrible headaches and TMD problems.
Right.
And then my youngest son had severe problems with headaches, and he was colicky when he was a baby, and it went into ADHD. And from that he went into headaches and temporomandibular joint problems. At age 7, I had taken him all the way to the Mayo Clinic even for some kind of diagnosis and treatment other than drugs. And you know, I tried nutritional counseling and vision therapy. And, I mean, we tried everything to help his headaches, and finally they sent us to a neurologist.
Right.
And the neurologist recommended I see a neurosurgeon, which I took him to see a neurosurgeon, and they wanted to do brain surgery.
On her son.
He was only 7 years old.
Right.
Yeah. And I was like, oh my gosh. And so at the time, I was a dental hygienist working in a dental office, and the dentist I worked for said, let me take a look at him before you do any brain surgery. And he said, I just took a class in myofunctional therapy.
Wow.
And he said, he's not swallowing right. And so he gave me some exercises to do with him at home to get his tongue in the right place. And then he also made him a little splint to wear. And we worked with an osteopath too, a cranial osteopath.
Okay.
And within 3 weeks, his headaches were gone.
Oh,
And it was like a miracle.
what a touching story.
And never to come back. All of his ADHD issues, he could focus.
Yeah.
Also, what happened within 3 months, his teeth started straightening out. He had this little narrow bite and everything started moving. So I thought, well, I have to learn more about this, and I studied everything I could. This was in the late 70s, so it's a long time. It was over 30 years ago.
Right.
And I've been practicing and teaching courses in it ever since. And it's very exciting, and I personally had issues myself because I used to sleep on one side and I had a crossbite and also a deviated septum. So I had jaw surgery, orthodontic surgery. And so I know what all that is like, going through all that between my husband and my youngest son and myself.
And yourself, right.
You know, it's been my life's work.
Right.
And the reason the last 3 years I decided, well, I'm not getting any younger, and I want to get this information out
Fantastic.
to the dental profession in this country so that they can be, first of all, aware that this therapy exists and that it works, and that they can build this into their dental practice to have another service available for their patients. And most of the patients I see, the first thing they tell me after they've had braces 3 or 4 times, jaw surgery, headaches, acid reflux, posture problems, surgery after surgery after surgery. I had a woman last week, a new patient who had 4 back surgeries for scoliosis.
Yeah.
And you see, your head weighs as much as a bowling ball, and your tongue weighs 3 ounces. So if your tongue is resting down and forward, it's just enough to pull your whole spine out of alignment.
Wow.
And this poor woman had been through so many problems, sleep apnea and orthodontics again and again and again. And I just thought, this has got to stop. The first thing they always ask is, why didn't anybody tell me about this sooner?
Sure, yeah.
And so for this to be part of every dental office, as it is, by the way, in Japan right now, every dental office is doing myofunctional therapy. It's taught in the schools. Dental hygienists do it. And they also teach it in the grade schools to children to make sure that they're all swallowing and chewing correctly.
And in South America, it's...
South America I just got back from Brazil.
Right.
The Brazilians, I mean, they think that, you know, this is just their standard of care.
Right.
That's their standard of care, and they treat all patients before they do any speech therapy. They say 70 to 90% of speech problems will disappear with myofunctional therapy. And they also talk about how they incorporate it into the cosmetic surgeon's office. The oral myologists there are all PhDs, and they go right into surgery with the plastic surgeons. And they also can specialize in orthodontics. And they wouldn't think of putting braces on without doing the functional work first.
Now, what about the United States? This is incredible, the opportunity that we as dentists have to bring this to our communities.
Absolutely. And there is new research out now showing that you will reduce the AHI number by 39% in mild to moderate sleep apnea with mouth exercises.
Wow.
Yeah. And also another study came out of Brazil showing that by extracting bicuspids, you are actually causing problems with orthodontic relapse with the muscles not working right.
Right, right.
And then the third study that was published this May in the biggest orthodontic journal in America, showing that the amount of relapse with open bites with myofunctional therapy versus not with myofunctional therapy was statistically significant. I think it was 3 millimeters difference, which is really big. So since May of this year, the orthodontists are really in favor
good.
of myofunctional therapy. And I think every orthodontist should have a myofunctional therapist or any general dentist who's doing any sleep or Invisalign or any type of temporomandibular joint problem. They definitely should get their hygienist trained and offer this as an adjunct to their dental practice. It's covered under medical insurance.
Well, this is a win-win-win and fabulous service for those patients and good for the practice. Joy, thank you so much
Thank
for
you
being
very
with us.
much. Yeah,
Okay,
this was good.
great.